My name's Liz Turner, and I'm an Open Research Account Executive with Taylor & Francis. My role is to work with F1000 institutional clients, providing account management support. I want to talk about a long-standing institutional partnership that really showcases the benefits of having an F1000 gateway, and that is the UCL Child Health Gateway. I'm going to talk about why UCL Great Ormond Street's Institute of Child Health decided to partner with F1000, some article metrics and publication highlights, the partnership ethos between F1000 and the institution being crucial to success, and some thoughts from Gateway advisors that illustrate the benefits of an F1000 partnership. The Gateway was launched in 2018 in a partnership between F1000 and UCL Great Ormond Street Institute of Child Health in order to bring innovation in research to child health. The Institute have a strong and proud history of innovation in the field, leading the way in preventative medicine, clinical genetics, and transplant technologies. Fittingly, this was the first publishing platform of its kind launched by such an institute. This spirit of innovation is an integral part of the F1000 model. The Gateway would enable researchers to share results quickly and with optimum transparency in a way that supports reproducibility. Making both the research and peer review reports available meant that the research community could judge the merit and usefulness of the work for themselves, and so the work is able to make an impact sooner. It enables reanalysis, replication attempts, and data reuse, bringing benefits to other researchers as well as society more broadly. Finally, researchers at the Institute could now publish not only their research papers open access, with full underlying data also publicly available, but an incredibly broad range of article types: clinical trials, case reports, systematic reviews, data sets, methods, tools, and many others. This encompasses the whole spectrum of possible outputs from this community of researchers, so that valuable research work that happens not to meet the editorial criteria of traditional journals can still find a home. This is an approach that can be brought to any multidisciplinary institutional gateway. So to put some figures to what we've achieved so far, 22 articles have been published on the Gateway. 9 of those were in 2020, showing the importance of timely and transparent publication. There have been a range of article types published, mostly original research, but with other important material appearing in the form of study protocols, brief reports, and opinion pieces. So researchers are making use of the ability to publish in these multiple formats. In terms of indexing, 14 of those 22 publications have received 2 or more approved reviewer reports, in some cases 3 or 4, and they've progressed to being indexed via Scopus, PubMed, etc. What's really important to note about this is that it suggests the community has bought into the open peer review model and sees the benefits, and are willing to support their colleagues striving for transparency. The turnaround time for indexing after the reviewer reports come in is typically a few weeks, so their discoverability is optimized right away. I wanted to show you the impact that these articles are having in the real world. You can see on the right here a screenshot of an individual article's metrics, which we always display alongside the article on the Gateway, showing transparency in this area and helping readers see those chains of sharing and citation that are becoming ever more important in the open access landscape. Here on the left, I've put some overall figures that, taken together, give some indication of this. Are they being read? The answer is yes. Combined, these articles have been viewed 29,000 times and downloaded 5,500 times. Altmetric Explorer shows that these articles have accrued 137 mentions between them. So that means that their DOIs have been shared in news reports, blogs, and social media 137 times. Altmetric is a dynamic way of tracking their usage and how they're being shared outside of citations. Finally, those 14 articles indexed on Scopus have gathered 45 citations between them at this point in time. Again, this speaks to the demand for transparent publishing enriched with open data of this kind. Some of this usage will have been driven by the rush to understand and treat COVID-19 over 2020 and 2021, but actually not all of it is about the COVID boom. The articles that have seen growth over the past 18 months or so cover neuroscience, maternal fetal health, and genetic disorders, amongst others. Looking closely at the top performing articles, the research that's being most read, shared, and cited, there are some great success stories to be found. This first article, a brief report on inflammation and its link to COVID-19, was first published in November 2020, but became one of the top 10 most read F1000 articles of 2020. The second article is an observational study on oxygen deprivation, which attracted a great deal of media attention as reflected in its altmetric score, being mentioned by mainstream news sources shortly after its publication, as well as on Twitter and various blogs. The final article I will mention here on neuroscience has accrued 6 citations according to Scopus and 1.4 thousand views, half of which are from PubMed. So readers and researchers are finding this article on a variety of databases, as well as going to the platform, making the reach and discoverability of this content apparent. Each of these articles, from a variety of disciplines and topics within health science, in its way illustrates the impact of the benefits of transparency and openness in publishing. So to what do we owe these successes? In large part, this is due to the ethos of partnership between the Institute and F1000. From the beginning, we have fostered strong relationships, including PIs and open access contacts at the Institute, working together to introduce the publication model to researchers and advocating for the Gateway. Currently, the Gateway Advisory Team is made up of 10 representatives from across the research and teaching departments of the Institute, many of whom have published on the Gateway themselves. We meet twice a year to discuss progress and strategy, sharing data on the Gateway's performance and planning activities for the next 6 months. At the moment, we are working on developing online resources that will enable Gateway advisors and authors to promote the UCL Child Health Gateway and conducting outreach at departmental meetings. We are proud of fostering these engaged, consultative customer relationships, supporting them to make the most of their Gateway and helping their community understand its benefits. I wanted to close my presentation with a few words from our much valued Gateway advisors who have been instrumental in the Gateway's development, and I hope you can see how vital this is to their open research efforts. Professor Ros Smith, the Institute's director, says, "Much of UCL Great Ormond Street Institute of Child Health success in the past has been through partnerships. That is why we are very positive about our partnership with F1000 in changing how the academic publishing system works." Professor Smith's words here reflect the drive to innovation to forge a better, more transparent path for research dissemination, a drive that F1000 and the Institute share. Professor John Akerman, a senior research fellow and professor who has published himself on the platform, says, "With the increasing demand from funders to publish data in open access format, I think it very useful to have a more local platform available, which can also highlight the breadth of child health research at UCL." John highlights that a dedicated F1000 gateway helps researchers to meet the demands of the changing research landscape while maintaining a sense of locality and community, making the institution's brand and values stronger and more impactful. Professor Patrizia Ferretti, who as well as being a Gateway Advisory Board member has also published on the Gateway, summarises her experience of authorship for us here. Professor Ferretti says, I'm very supportive of the F1000 interactive model, which provides the opportunity to share not only new exciting data, but also the possibility of sharing robust negative data, helping to formulate better questions and design more relevant experiments, as well as reducing research and time cost. In addition, the possibility to continue to add data to a study as it expands is a great feature. The transparency of the review process is also a plus factor. Here she summarises a researcher's perspective, highlighting how the publishing model has helped her team push their work forwards and showing the benefits of publishing negative findings. This is a benefit that researchers in medicine will see, but also in life sciences, social science disciplines, and STEM subjects. The availability of such findings ensures that no research output goes to waste, making the process of conducting research as efficient as possible. Professor Ferretti also draws attention to the ability to revise published works as a new study expands or as new finding emerges, and the transparency of the review process, which is intended to facilitate a more collaborative relationship between author and reviewer, so that it becomes less of a grading exercise, more of a conversation. Finally, I couldn't hope to summarise the far-reaching benefits of an F1000 institutional gateway better than these words from Martin Elliott, UCL professor and clinical ambassador. Martin says, those submitting research data gain the most immediate benefit. The process is smoother, faster, and more responsive. Those giving money for research see a guaranteed output of their investment. The reader can identify the reviewer and comment. The audit trail adds credibility. And the availability of the raw data gives benefit to all in the field wishing either to replicate or to modify a study. Everyone wins.